Ovarian cancer surgery is not like the other surgeries you commonly see around you. In our clinic, we routinely observe that patients and their families face dilemma and confusion when dealing with ovarian cancer. Today, I will provide clear answers to 10 commonly asked questions about ovarian cancer surgery. And at the end, a bonus point for you. The 2022 Globocan data projection suggests that if we do not do enough to prevent ovarian cancer by 2050, the number of ovarian cancer cases will increase by 55%. The World Ovarian Cancer Coalition suspects that most of these cases will occur in low and middle income countries. Therefore, we must increase awareness about ovarian cancer prevention and surgeries too. Today, I have tried to address 10 important questions that women commonly ask before undergoing ovarian cancer surgery. At the outset, I must mention that this information will be useful to those 85% women diagnosed with ovarian cancer where a biopsy has been done before surgery to confirm the diagnosis. This article is not for the women where a tumor has been found through a scan but biopsy confirmation has not taken place before surgery. For them, there will be another article. This article will also not cover surgeries for borderline ovarian tumors. However, for the rest, this will be very useful. The majority of ovarian cancer are diagnosed when the cancer has spread beyond the ovaries. This may be indicated by accumulation of fluid in the abdomen or chest. About 85 out of 100 women are diagnosed with ovarian cancer at this advanced stage. First question: will this be an open surgery or laparoscopy or keyhole surgery? For advanced ovarian cancer, the surgery is typically done using the open method. Don't get confused. To check the extent of the spread, sometimes a special laparoscopy technique or procedure known as staging laparoscopy is performed. However, the surgery where the tumors and spread out lesions are removed from the abdomen is most often done by a midline laparotomy, which is an open surgery. This is known as cytoreductive surgery. In this procedure, the incision is vertical up and down cut rather than a horizontal cut like cesarean section, because a horizontal cut down below will not allow for complete clearance of upper abdominal diseases. Currently, there is no proven role for laparoscopy or robotic surgery in treatment of advanced ovarian cancer internationally. If you are anxious about the pain associated with open surgery, please do not worry. Modern anaesthesia is very effective and covers the pain during surgery and for several days afterward. Question 2. First chemo or first surgery? According to internationally recognized researchers, advanced ovarian cancer is treated in two ways. In one option, the surgery is performed first, followed by 6 cycles of combination chemotherapy. In other option, 3 cycles of combination chemotherapy are given first, then surgery is performed, followed by remaining 3 cycles of chemotherapy. Over the last decades, many studies have shown that there is not a significant long-term difference in cancer-free outcome between these two treatment pathways. These studies are of very high quality. When advanced ovarian surgery patients come to doctors, generally ovarian cancer is first confirmed through diagnostic biopsy test. Then, aim is to perform surgery followed by 6 cycles of chemotherapy. The upfront surgery is known as primary cytoreduction surgery. However, in some carefully selected cases, the condition of the women or the spread of the disease may make initial surgery unsuitable. In these circumstances, chemotherapy is given first, followed by surgery, and then more chemotherapy. This type of surgery is known as interval cytoreductive surgery. In both types of surgeries, the primary aim is the same: to completely remove the cancer affected areas. The suitable treatment for you will be based on your health condition and discussions with your treating doctor. Question 3. Will I suffer from pain? Nowadays, science has developed many advanced techniques to avoid pain around the time of surgery. Whether I was in Manchester or working in Kolkata now, we have already paid special attention to managing patients' pain. Even if the surgery is open, patients do not usually suffer from much pain. Pain management starts before the surgery, ensuring that the patient remains pain-free during and even after recovery from surgery. Even when recovering in the bed, patients do not suffer from pain. Once a patient comes out of the operating theatre after a successful surgery, nurses check her pain level every hour, known as pain score, as per World Health Organization and WHO guideline based on patients' needs. Nurses and doctors provide adequate pain relief medicines. It is true that in recent past, surgical pain during major surgery was a major concern. However, our expert anesthetic consultants can offer epidurals and various other advanced pain relief medications and technologies, allowing most of the patients to go through the surgery with smiling faces. Question 4. What organs are removed during surgery? Whether you have primary cytoreductive surgery or interval cytoreductive surgery, the main aim of the surgery is to remove all cancer-affected tumors and organs. Ovarian cancer can attack almost every organ in the abdomen. Therefore, surgery for ovarian cancer is far beyond removing the ovaries only. Apart from removing one or both of the ovaries, sometimes we may need to remove part of the bowel, some lymph glands or omentum. The omentum is a layer of fat that stays in everyone's abdomen. Additionally, the inside lining of the abdomen, known as the peritoneum, may need to be removed because ovarian cancer frequently involves the peritoneum. Sometimes we may also need to remove the spleen, part of the liver, and of course the fallopian tube and uterus. Only the areas attacked by ovarian cancers are removed. Extensive research over last couple of decades has proven beyond doubt that increasing the intensity of the surgery and aiming to remove all cancer-affected tissues and organs can provide better benefits for the patient. However, sometimes due to the aggressive nature of the advanced malignancy, even if the doctor has the required surgical skills and team, full clearance of the cancer may not be achieved due to a potential side effects in future. In some small number of cases, there is a concern that if the cancer is fully removed and number of organs are removed, the remaining life of the patient may not have good quality of life. For example, if the cancer has involved the root of the mesentery or the blood supply of the liver, that means porta hepatis, the surgery cannot clear diseases in those areas because the outcome would be incompatible with life. Despite these challenges, in the majority of the cases, ovarian cancer surgery can be completed successfully. In most such surgeries, we have a multidisciplinary team that includes a gynecological oncology surgeon, a consultant bowel surgeon, and a neurosurgeon. Over the past couple of decades, gynecological oncology surgeons have devoted much of their training to mastering these very tough surgeries. Such training takes a long time, and this operation is known as cytoreductive surgery, primary or interval. Question 5. Will I wake up from anesthesia? Compared to the type of anesthesia used 30 to 35 years ago when I was studying in medical college, anesthetic techniques and science have improved significantly. Anesthetists nowadays are more up to date with international standards and can administer high quality anesthesia even in Kolkata. This is not an easy task, but it is definitely possible. Many patients requiring ovarian cancer surgery suffer from diabetes, blood pressure problems, obesity, and other complex comorbidities. Ovarian cancer is frequently diagnosed as a late stage, which can result in poor nutrition and lower physical reserves. Therefore, anesthetists take many precautionary steps to ensure better quality anesthesia. A lot of preparation takes place before surgery, known as prehabilitation. You can read about that in the prehabilitation article link in the description box below. Question 6. How soon should one have surgery? The diagnosis biopsy of ovarian cancer itself may take a few days. If it is suspected that ovarian cancer or tumor is confined within the ovary, a needle biopsy is not done. However, if the cancer has spread throughout the abdomen, the fluid accumulated inside the abdomen and a solid tumor tissue sample may need to be checked for biopsy and special tests to determine the best treatment. Doctors usually aim for a pre-surgery or pre-treatment biopsy, which often includes a special test such as immunohistochemistry. This step-by-step diagnosis may take some time, but it is a great investment for proper treatment and to avoid misdiagnosis and mistreatment. During this time, many patients may become impatient and wish to undergo a surgery without proper tests. However, such temptations should be avoided. In some cases, ovarian cancer may be a manifestation of cancer from another organ, such as stomach, pancreas, colon, or even breast. These are known as Krukenbach tumor, and we have a separate video link for that. Link will be below. Question 7. Do I need any other treatment after ovarian cancer surgery? Even if the ovarian cancer and spread out tumors are completely removed during surgery, chemotherapy is needed in the majority of cases to minimize the risk of cancer returning. In some early stage cancers, such as stage 1A or low-grade ovarian tumors, chemotherapy is avoided because it may not be effective. Sometimes genetic tests are done to check the suitability of additional immunotherapy or targeted therapy apart from traditional chemotherapy. For more information, you may want to check our video on personalized gynecology. The link will be in the description box as usual. Question 8. Where should I get the surgery done? Before selecting the right doctor, right hospital, and the city for the surgery, consider a few important pointers. The operation is not just a few hours long. The treatment continues well beyond the surgery. Over the next 5 years, you will undergo oncologic follow-up. If you get operated on one city, receive chemotherapy in another town, and get follow-up in a third city, that option is not smart. Therefore, choose your doctor and hospital wisely so that you can get the treatment in the same city. It does not always have to be in the same hospital, but having the surgery and other treatments in the same city is crucially helpful for patients and families. Most advanced doctors will treat patients as per international guidelines, so variation between different centers is unlikely. Sometimes patients complain that even if they see a senior doctor in the clinic, the actual operation is performed by a junior doctor. Therefore, do ask before you undergo surgery who your exact surgeon will be. As I said, the surgery is not like other surgeries. If the operation lasts for a few hours, the surgeon will have to be personally busy with you for the whole time. If a senior surgeon performs the surgery, the cost will be slightly higher because we always take extra precautions and use modern instruments. Without these additional safety net, we will refuse to do surgeries. And of course, the senior surgeon will have to give you quite a few hours of their time for best of the outcomes. Question 9. Pre-surgery preparation. Several preparations are required before this type of cancer surgery, some of which I have mentioned in the anesthesia preparation section. Before the operation, you need to eat enough protein, do breathing exercises, and walk accordingly to a specific guideline. Pre-surgery preparation is a significant science known as prehabilitation. There is a link in the description box about this. You can read if you need more information. Following these prehabilitation methods will not only lower your hospital bill but also will help patient recover faster. Question 10. What will be the cost? After spending more than a decade in England, I started to work in Kolkata. I came to realize the hard reality that good quality surgery is undoubtedly costly. Without direct government subsidy, performing these type of complex cancer surgeries cheaply is impossible. Unfortunately, there is no shortcut to it. Surgery is far beyond just opening the abdomen, removing the tumor, and stitching the abdomen back. Modern surgery is all about risk management, where we have to choose the exact right antibiotics, instruments, and chemicals to avoid bleeding during surgery. Training the team is also quite costly. Let me give you an example. The stitch used in surgery is little more than a foot long and costs more than 700 rupees each. Each of the operating instruments is extremely costly because the manufacturing uses medical grade steel, which is very expensive to produce. Apart from that, the chemicals and methods used to clean the surgical instruments and the time it takes to clean the surgical theatre all have got their costs. Experienced doctors and nurses can also be quite difficult to get. However, because this surgery is a matter of life and death, do your research adequately and ask all the questions you want to ask. If the cost of the surgery vary between insurance companies, then please investigate thoroughly. Sometimes insurance companies will deduct 10% of the hospital's payments. Apart from these 10% variation, if you notice a significant fluctuation or difference between two insurance companies, you should be suspicious of what is going on. The cost of the surgery should not vary with the type of insurance and the company. Two questions to ask. Why the cost is higher in one insurance company? Are they charging unnecessarily? The second question is that if the cost is very cheap, is the cheaper company allowing surgeons to use enough modern technology for your surgery or not? Bonus question. When will I return to normality? In our practice, patients start to walk the day after surgery. Of course, this is not easy to achieve. And we provide international quality pain relief and arrange for well-trained physiotherapists to help you take steps. You will need to be cautious for a couple of weeks after surgery. Approximately 1 month after surgery, you should be able to walk on outside road. The more you walk, the faster you will recover because it increases blood flow in your body. If you want to drive a car, it is generally safe to do so within 1 month of surgery. It is better to avoid heavy weightlifting for up to 3 months after surgery to ensure adequate healing and to prevent future problems like hernia. If you do not use tobacco or have diabetes, your recovery should be even faster. I have tried my best to cover many of these common questions that are asked. If you have got any other questions, please ask in the comments and I will try to answer them. Our channel has got very many videos on ovarian cancer, so feel free to explore and understand the modern science around ovarian cancer and its treatment. Wishing you all the best for your treatment. Get well soon.